lot of questions about this topic this year. The transition from being cared for and having your condition co-managed or managed by a caregiver or family member, and as you move into managing your care for yourself as a young adult. Even just this week, we've recently received a couple of calls and questions about this very topic. So we're very excited to bring our two webinar, the two individuals that we'll be interviewing, in our webinar this evening. We're excited to have them both speak to this topic, and it will be moderated by Andrea Rideout, GADA Science Director. The title of this webinar is Transitional Care Webinar, Guidance for Teens and Families with Aortic Disorders on the Transition from Pediatric to Adult Care. Given that some of our attendees listen to the webinars, I will be reading the slides. Even though some of you are able to view the individual slides, I will make a point of reading them out until I hand over to Andrea and the rest of the team. I think it's very important to read out our disclaimer. This information, in particular, the medical and scientific information contained during this virtual event, is provided with the understanding that this programming is provided by a voluntary health organization and is not engaged in rendering medical advice or recommendations on diagnoses or treatment of any aortic disease or genetic aortic disorder. The contents of this meetup, such as presentations, discussions, text, graphic images, and other materials, are for educational and informational purposes only, and as a benefit and service in furtherance of GADA Canada and its mission. Genetic aortic disorders are complex and multisystemic, and that can only be properly diagnosed and managed by skilled and trained healthcare professionals. The manifestations and severity of these disorders vary greatly among individuals and require personalized medical management. None of the medications, courses of treatment, or lifestyle and activity recommendations discussed in this virtual event or the GADA Canada website should replace necessary consultations with qualified healthcare professionals. At this point, I'd like to take a couple of minutes to discuss a little bit about GADA Canada and MAC. GADA, Genetic Aortic Disorders Association of Canada, is a registered patient advocacy organization promoting research-based awareness, education, and support to patients with genetic aortic disorders. We're dedicated to saving lives and enabling a promising future for individuals living with genetic aortic disorders, including Marfan syndrome. Co-founded by GADA, MAC, the Montalcino Aortic Consortium, which you'll see if you spend any time on GADA's website, is an international research collaborative of multidisciplinary clinicians collecting patient data to generate gene and variant-specific models for personalized medicine to improve outcomes of individuals with genetic aortic disease. I'd like to take a moment to introduce Jacklynn Pidduck, our first presenter. She's a registered social worker and transition coordinator, IWK Health Children's Health Program in Halifax. IWK is the children's hospital in the Maritimes, similar to Sick Kids in Ontario and BC Children's in Western Canada. In this role, Jackie supports the Transition of Care Committee, which brings together patients, caregivers, healthcare providers, and community partners to improve the transition from pediatric to adult healthcare. Through their research and community engagement, the committee created a transition framework to help guide transition practice locally, and now work to embed that framework into practice in pediatric, primary, and adult care. So thank you, Jacklynn, for making the time today. And we're excited also to welcome Lindsey Rusche, a patient advocate and the Think Aorta Canada lead. Lindsey's dedication to supporting individuals with aortic disease and genetic aortic disorders has been her true calling, leading to over 10 years of service as a volunteer patient advocate. She's volunteered with GADA alone for many, many years, and we're very excited to welcome her back to this webinar. She's held multiple senior volunteer board roles, contributed to clinical and research-driven patient projects, and developed and facilitated patient workshops. Lindsey's also shared her personal journey at conferences and webinars and has provided one-on-one patient support when necessary and when she can. Based in Toronto, Lindsey is a communications professional with more than 20 years of experience creating engaging, impactful content across the financial services, nonprofit, and technology sectors. Lindsey is currently the patient lead for Think Aorta Canada, a global campaign built to awareness and educate about aortic health and to encourage quick diagnosis of aortic dissections to help save lives. So at this point, Jacklynn, I invite you to share your screen And I'd like to take a moment to introduce Andrea Rideout, our new science director at GADA Canada, who will be moderating the rest of the webinar.
Thank you, Linda.
Thanks so much, Linda. Really appreciate the introductions, and so great to be here with Lindsey as well. We've got an opportunity to sort of work together to bring this to fruition. So very grateful to be here. This is certainly a very short session in lots of ways on a very big and sometimes complex topic. So our hope tonight is just to give you enough information to give you some things to consider and talk a little bit more about with your healthcare team. I will share some of the things that I've learned as part of our Transition of Care Committee that brings together patients, caregivers, healthcare providers, all looking to improve transition. So I'll share a little bit of what I've learned through that work, and Lindsey's going to share what she's learned as a patient navigating transition. Certainly my information is quite general to transition, whereas Lindsey's going to have more specific information around genetic aortic disease as well. We will sort of look at this webinar primarily from that perspective of a patient, from a young adult who's moving through this transition. But hopefully we'll bring some universal ideas forward that are really helpful to everyone in the audience. We're going to talk first about how we define that transition to adult care. We'll give some transition tips, talk about the importance of knowing your health history, talk a little bit about some of the health management skills you might be looking at, preparing for appointments, especially as you prepare for adult care. Lindsey will talk a little bit about managing the journey, this transition journey, and then we'll provide some additional resources and leave some time at the end for some questions. So hopefully that sort of fits for what might be helpful for you. When we talk about transition to adult care, a number of the young adults who we work with on our committee will say very specifically, it's a thing. But it's not a thing that we talk about a lot. And so that transition to adult healthcare, maybe not even some language that you've heard before. It certainly in different parts of the country might have different terminology at different times. For today, though, we'll talk about that transition from pediatric to adult healthcare. And we mean that as the things that are sort of important for us to consider when we move from pediatric to adult care. And we talk about being a thing because it isn't one that we talk about or hear a lot about sort of outside of a healthcare setting. We know lots of milestones in our lives, right? We know that at 16, we can get a driver's license. We know what happens when we move from junior high to high school. And we know that as we finish high school, we need to start preparing for what's next after high school. But leaving the pediatric health system and going to the adult system is also a big thing. And outside of the healthcare system, we don't talk about it a lot. So sometimes we even find that some young adults and some families don't even realize that just pediatric care just is sort of part of your experience. And you sort of sometimes don't even realize, oh, wait a minute, I'm going to be leaving this healthcare provider, this healthcare team. What is that going to mean? What is that going to look like? So certainly our hope tonight is just to sort of increase that awareness that transition is a thing, and also knowing that there's can be sometimes lots of emotions around it too. So some excitement, some frustration, some worry, some concern, all sorts of sort of mixed bags about this new chapter. So sometimes it's also when you've been in pediatric care where there's pink elephants on the walls and people talk to your family and maybe they don't talk to you as much as you hope for. Sometimes also going to adult care is kind of a great new chapter that people are really looking forward to as well. So leaving lots of room for all the different emotions that can come up with this transition. And we know that everyone has their own health history, their own skills, their own abilities, and their own life experiences that are going to vary also from different communities, different parts of the country that you're in. So really, this presentation is just to help start us to think about what might work for you. What are your strengths as individuals or as families? What are your concerns? And where do you need a little bit more information and need to check in with your healthcare team? So it can be a lot to take in. If you need a break at times, feel free to take a break and come back as you need as well. So when I use that term transition, I like to think about it as a bridge. So that bridge from pediatric to adult care. And our hope is that we've got pediatric on one side, adult on the other, and hopefully some primary care providers sort of throughout the middle as well, who is part of your care continuum. I know that can be in lots of different shapes and forms for people, but that's the hope, is that across the board, you've got pediatric, adult, and primary care. And we think about it starting from those first times that you're coming to the health center and coming into pediatric care. That's the start of transition. We want to begin with the end in mind, the idea that we're going to get to a place where we're navigating the adult healthcare system and doing well. But on the way, we want to be thinking about that purposeful and planned movement so that around 12, 13, 14, 15, we're starting to really think about, okay, what are the skills and needs that I have that I need to figure out so that I can manage in adult care. So we want to see individualized planning, coordinated transfer, and then secure attachment into adult care. So the transition is quite long and broad, and even happens in adult care because we're still learning and figuring out how to manage your own care and lots of different things in adult care. But that transfer point is the point where you leave adult care and go to, when you leave pediatric care, and go to adult care. And so sometimes we talk about transfer as that's all of transition, but really we want to make sure that we're thinking about transition as really a long-term process with transfer as a one point in the bridge. And sometimes it's important to have those conversations about when transfer is with your healthcare provider, because every team sometimes can do it a little bit differently. And it might have a lot of different pieces that go into the decision about when the transfer happens. So always good to be asking your healthcare team, when does this happen? It doesn't necessarily mean it's going to speed it up, but hopefully it means that you're going to feel more prepared for it when it does come. And when we talk about that transition, sometimes it's important to get some ideas around some of the language. So what's the difference? So we have primary care. That's your family doctor, your nurse practitioner. It's the way that you go to a pharmacist to discuss your prescription. Some folks might have like an 811 where you can call in to a registered nurse to get health information. Lots of different things that sort of provide primary care. Oftentimes that family doctor, that nurse practitioner understands the big picture, can help coordinate your health services, and they're the ones who can make referrals to specialists and hopefully sort of stay with you from birth to adulthood. So hopefully they're the consistency. Your specialist care is going to be, especially in adult care, might be more specifically dedicated to one area of medicine, focusing on like one organ of your body. So that can look a little bit different as well, because sometimes in pediatric care, our pediatric specialists sometimes take on a little bit more of a primary care role. And so what we really encourage is, as you get a little bit older, really starting to make that connection, making sure you've got good relationship with your primary care provider as well. And then, of course, our allied health team is also really important in our healthcare journey as well. So thinking about your therapist, maybe your nurse practitioner, social work, genetic counselors, all those people who also provide help and support. So thinking about who are the roles and what will you need when you land in adult care. And then that difference, what's the difference between sort of pediatric care and adult care? So lots of similarities in lots of ways, but sometimes the team looks a little bit different. So in pediatric care, your team might have a team attached a little bit more. You might have, again, the nurse and a social worker and a dietitian or things like that attached to your team. And adult care, that might be just one specific provider, and then they may consult out as you need different things. Certainly it's going from that child-friendly environment to an environment where maybe there's more seniors, citizens as well, and that can be a bit jarring. So you might be ready to leave the clinic space with the pink elephants, but that it can be a little bit different when you sit around a clinic space and have older adults who are maybe at different parts in their healthcare journey around. That can be a bit of a change. They're also going to start in adult care, as you would know, sharing more information with you as opposed to sharing it with your family. Some young adults find that really helpful, that they appreciate that their adult care providers are really listening to them. And certainly that link to services. In pediatric care, sometimes it's all under one building, even sometimes, and they have easy access, and maybe the different specialists know each other and have more ability to collaborate. Whereas in adult care, you're going to see that more specifics around who's the specialist. I need a separate appointment for that. And certainly there may also be times when you're asked to see your provider on your own in pediatric care. That might be more the case in adult care, but remember, you bring who you need to your appointments as well. And so that's really important. If you need some support, many of us do. Many of us need to make sure that we have a second set of ears around when we are having appointments with our specialists. So know that it's always okay to have someone with you to support you. Both want you to ask questions, both want to be able to help out, and both teams definitely want the best health outcomes for you. So ask about what you need so that you can get the help you want. And when we talked to our Transition of Care Committee, we went out and we did some research a little bit to talk to youth and caregivers about their experiences of transitioning from pediatric to adult care. And so they talked about a number of things. The youth talked about the importance of learning about their health condition, but also learning about transition, that sometimes this just wasn't something that they really understood. So they knew they had to figure out their health condition, but this other piece around how do I transition, how do I learn to advocate for myself was a newer process. They also talked about being in multiple transitions. They're trying to figure out the transition from school, work, all these other things, as well as trying to figure out that transition from pediatric to adult care, and that can be a bit challenging. And so they're looking to be more independent and learning that self-advocacy skills, but really want to do that as a soft launch. So excited to do it, but want to do it in a stepped approach. And what they really talked about too is that the way that healthcare providers talk about transition matters. So when we as parents or as healthcare providers share like negative views about the adult care system or are sort of full of fear and anxiety ourselves, that can also help or not help, I should say, in that transition. So the key message is really important, that how we talk about transition matters. And parents and caregivers are talking about how they're shifting their identity, right? And trying to take the expertise that they have and support and shift that knowledge to their youth, and how that can have some challenges and also some emotional challenges from that experience. So if you are in that place and space, know that you're not alone. And certainly when we talk to youth, when we talk to parents, when we talk to healthcare providers, everybody talked about the fact that a little bit more system coordination and coordination would be really helpful. So I won't go into it too much, but part of the work that we've done now is to create a transition framework. And we did that in partnership with Nova Scotia Health, who's one of our adult care partners. And we looked at individualized planning, so making sure that we're assessing healthcare skills, having a system to track transition. We looked at coordinated transfer, so making sure that we're talking about that transfer at least 1 year prior. The young adults that we talked about really wanted to know and understand, where do they go? How do they get there? When do they see their adult provider? So the specifics about the coordinated transfer is so important, and involving their primary healthcare provider so that the primary healthcare provider, the family doctor, the nurse practitioner, knows what's going on as well in transfer. And then we really are looking to support trust building. So how do we create positive anticipatory guidance that's realistic about what adult care looks like? So always be a good idea to be asking your pediatric providers, what is it going to be like when I go to adult care? What am I going to need? What does that look like? And to share some positive but realistic information about that. And of course, we have these other pieces around engaging youth and families in the process, making sure that we consider health equity and complexity of care, and having a system to set and track goals of the care team to improve transition. So there's more information on our IWK website if you're interested, but that's just a little snippet of our transition framework. Our general transition tips are pretty simple and straightforward. Transition is a thing, so talk about it. Talking about transition won't necessarily make it happen any faster, but hopefully you'll feel more confident and prepared to make when you make the move. You want to start early and repeat often. So keep talking about it, keep working on those skills. Know who your champions are. So that might be members of your family, people at school, people on your healthcare team who can help you to work on those skills. Know who you can rely on, and try it out on your own. So maybe you've never tried to take your medication all on your own without any hints or reminders around. This is the time to learn and you've got that safety net. So go out and try it while you've got your support system, and then make sure that you always know you can ask for help. So your healthcare providers are here for you. Talk with your team, talk with your family, talk about what you're excited about, talk about what you're worried about, and ask your questions about transition. And sometimes providers will say things like, oh, don't worry about that, it's a while from now. Say, no, it's going to come faster than I think. I want to talk about it now. And one of the things in terms of building your skills is making sure that you know your health history. So a simple piece to think about sometimes is this 3-sentence health summary. And we think about doing it this way because sometimes, especially when we have longer or more complicated medical histories, it's important to sort of think through, how can I make this succinct and understandable, so that if I go to the emergency department or I have to go to a walk-in clinic, I can sort of easily explain and I know what is most important to include. So this 3-sentence health summary involves, sort of sentence 1 is like my age, a diagnosis, sort of a brief medical history. Sentence 2 is a little bit about your treatment plan. And then sentence 3 is what your question or concern is that you want to talk about at the visit. So it can be helpful to try these out. Think about it when you're with one of your healthcare providers and ask them, so this is what I would put in my 3-sentence healthcare summary. Does this fit? Does this make sense? And so Andrea was helpful in trying to give us a bit of a overview of what something might be. But my name is Jane. I have an inherited type of heart disease that causes aortic aneurysms and dissections. And then you can let them know what their name is, talk about what your treatment plan is, when your last CT scan was, a little bit more about what your screening has been part of. And then I've got two question 3s here. So you can talk about, I've come to the emergency room because I'm experiencing severe chest pain that radiates to my back and stomach. I'm worried I could be having an aortic dissection. Or it could be, you know what, I've been recently diagnosed with ADHD and I want to know how my medication might interact with my condition, or if it's safe to take. So this 3-sentence health summary is used in lots of different places. So if you're different health centers across the country, you might see it. There's also a transition app, and that transition app called My Transition App that you can find online also has that 3-sentence health summary that you can use. So that's a really quick snapshot of a possible easy piece around a 3-sentence health summary. I'm going to throw it to Lindsey now, who's going to talk a little bit more about a broader health overview that might be helpful as well.
Thank you, Jacklynn. I, being 52 years old with Marfan syndrome, I was diagnosed at 9, emigrated from the UK when I was 10, and obviously went from initially at Sick Kids and then to Toronto General. My family lived in Barrie when we first moved here. So I'm, obviously have been through this transition before. It was 35 years ago, so there was no internet. We didn't get a lot of information. So I did a lot of this sort of without any of these things. So it's really great that we are able to get lots of information from all of these organizations and lead us through this path, because it definitely was, me doing it by myself when I went to university. Obviously, I had the basic information that I took a medication, that I'd had multiple surgeries as at Sick Kids. I'd gotten booted over to Toronto General. That's all I knew. It kind of went from there. So what I've really done, and sort of to follow on top of what Jacklynn's talking about, this 3-sentence summary, is over the years of living with a genetic aortic disorder, I've had lots of complications. I've had lots of surgeries. I've had lots of things happen. About 20 years ago, I started developing just a one-pager for myself that I keep up to date on my computer, now on my smartphone, that I sort of, it's quite big and compressed into one, still on one page, but very busy now. But originally it was just, those top level things that if I ended up, especially at an ER, or even if I just went to the dentist, or I had to go see a physiotherapist, or it could be anyone, or I had to move GPs, or all of the different places you might interact with someone in the healthcare system. Even as something like a naturopath, they still all need to know that you have these underlying conditions, that you take certain medications, due to interactions and all of those things. I started developing this document. So this document has lived with me and continues to grow. I update it every time I add medication, that something happens, and if I get allergic to something, and it's something that I have at my disposal all the time. And I can tell you, as sort of tried and tested, I've used it all over the world. So just so you know, it works. And there was no one gave me this information. I've sort of built it up over the years, really because I've had a lot of complications. So there's information that I need to tell. So those first sort of that summary piece that Jacklynn talks about obviously is the part that we really care about. We want to make sure somebody knows that you have this unusual genetic aortic disorder. So whatever disorder you have, whether it's active 2 or LDS or Marfan like me, or you've had an aortic dissection, could be many, many things. So, the basics on this list, of course, that I've highlighted are your name, your healthcare number, of course, if you live in Canada, date of birth, your blood type, which is also a great thing to have on here, known diagnosis, if you know what I mean. You don't necessarily have to have even said I've had genetically tested or not, but it's important if you have it to include it, because it also helps to guide some of the guidance that's available to specialists or ER physicians. The other thing that I sort of add on mine is, because I have had certain complications via systems. So I've had scoliosis, I've had back surgery, I've had lots of eye surgery. I've you know what I mean? I add those things almost as like by system. So they can quickly read, okay, this person's had this, and this. This is their broad diagnosis. Great. For sure, it's definitely a synopsis. It's not all the details that they could get if they talked to a doctor who would have cared for me, but anything that they may need to care for me, especially in an ER situation. So that is kind of why this, lives with me. Medications, obviously incredibly important. Surgeries that I've had, previous surgeries. If you have room, obviously including your main GP or primary care. And then also a family contact name, obviously incredibly important. Hopefully in there that there's, sort of if someone has to make a decision on your behalf, if that is the situation, you have somebody there, or if it's just, can you call my mom? You know what I mean? So I have found this document, if you sort of start doing it early and develop it over the years, you're really going to get used to having this. And frankly, the amount of times I go to the dentist and the dentist says to me every year, can you give me your updated thing? And they give me a form with these tiny little lines that I'm supposed to put 25 surgeries into one line. And I just start laughing and I say, look, I'll just send you my updated sheet, or I bring it in and I just give them a copy. It just makes your life way easier. You can navigate it, you can keep it on top of it. And then you also feel a little bit more secure, knowing that if you're ever in a situation where you need that information to be given to somebody else very quickly, it's available to you. Obviously, I also, being me, I'm on warfarin. I wear a medical alert bracelet. It's another thing to consider because it again triggers that I live with aortic risk due to my genetic aortic disorder. So something to think about. So these are like, I think as a habit to start, or even just slowly start developing. The great thing is we also have smartphones, and a lot of phones have these embedded within their phones. So you can just build this in. People can see it without even having your passcode. It's really great to start making this a habit. So that's kind of where I'm coming from. And I think this also helps address, I think people do get quite nervous about what if I'm not with my child or my parent, or you know what I mean? What if they're traveling? These are great habits to have. So thanks, Jacklynn.
That's great, Lindsey. Such a great resource. So helpful to have that overview. So once we've worked on sort of, okay, I'm figuring out I've got a system to know my health history. Then there's also that, okay, how am I taking care of myself? How am I learning to take on those skills? So these buckets of healthcare management skills are not official. They're just something I make up to try to explain it, because sometimes we get really focused on the hard skills. So can I name and describe my health condition? Am I taking my medications? Am I doing my physiotherapy exercises? Those types of things. Those hard skills are really important. They sometimes become where we put a lot of our energy. I know we have a readiness checklist at the IWK, and it does sometimes have a sort of leans a little to the hard skills. And then I like to think too that there are some soft skills to this transition work and to learning how to manage your healthcare. So being able to talk with your provider on your own, being able to advocate for your health. Sometimes also the ability to weigh treatment options. So one of the things that one young person will talk about is landing in adult care and being given a choice of 2 treatment options. And it was one of those things where she'd never actually been given that opportunity in pediatrics and realized she didn't know how to do that. So how are we figuring out what are my values? What's important to me? What are the risks? What are the side effects? What are the benefits of this particular treatment option? Trying to weigh those all out in terms of what's important for you. That's sort of a bit of a soft skill that's important. There might also be some things, especially when you have a diagnosis, that might mean that you might have a medical crisis that you need to have friends or family to help and support you with. One of the soft skills might be figuring out how to talk to, as you go to a new school or go to a new work environment. Who do you talk to about that? How do you do that? What do you want to keep? What are you keeping to yourself, and what do you want shared? And having sort of an understanding of how do I move through my life with my condition, and how do I share that information out so that I can feel most comfortable and confident. That's another sort of soft skill of transition that sometimes is the underlying piece we don't talk about. And then I talk a little bit about the grunt work of transition. So sometimes in some families, some parents continue to do things like calling in prescriptions, booking appointments, remembering follow-up requirements. And this is the stuff that sometimes as parents, as your young person gets a little bit older, it starts to become a bit of a work, like, I can't believe I'm still making their appointments. But part of that comes from this worry, right? That if I don't do it, something's going to happen. So it sometimes can be helpful in those early teenage years to think about all the skills that a young person is going to need to manage their adult health care, and figuring out how can I start gradually figuring out ways to build those skills for that sort of grunt work, the stuff that often is the stuff you're most worried about, and thinking about how do I slowly build up my teen skills to be able to handle that stuff. And then there's always things that are available to us to help us out, right? We can get autofill reminders on our prescriptions. We can get blister packs so that it's easier to see, did I take my medication? Yes, I did. So talking to your pharmacist. If you're struggling with your medications in some way, talking to your family doctor, to your specialist, or to your pharmacist about how can we make this easier? Are there some ways that we can simplify my treatment to make it easier to do? And then also as providers, as healthcare providers, thinking about how do we use motivational interviewing? How do we learn how to build people up to be able to take on goals and work through these? These are all the things that sort of help us to get better at managing our own healthcare skills. So for those of you who are looking now, I've just put on like a bunch of different things. There's a game called Never Have I Ever that often involves us saying, never have I ever climbed a mountain. Never have I ever sang a song in public. We're going to just take a moment to look at some of these pieces. There's just some random ideas that are sometimes on a readiness checklist, sometimes some things to think about. Never have I ever. See if there's anything on that list that you say, never have I ever organized my medications all by myself. As a parent, it could be, never have I ever talked to someone about my transition worries with my kid. So thinking about what you've never done, and then what you're actually already doing. So I think sometimes we forget, as we think about all the things that are coming at us in transition, about all the things we've already done and we're already learned to do. So as you think about the never have I ever, also think about, what is it that I'm already able to do, and how did I figure out how to do that? So the skills that you already know, what helped to make it a little bit easier to get those things done and to figure those out? And as you think about those pieces, what has helped? What's made it a little easier for me? I certainly will recommend that talking to your healthcare provider, seeing if lots of different, like BC Children's, I know lots of different pediatric centers will have some form of readiness checklist. It'll be called different things across the country, but everybody sort of has something. And if not, there's the My Transition app and some other things that you can look at. It'll find some skills. Because what you want to do is look at, what are the things I need to know to get ready for adult care? And then start thinking about, what's my goal? How do I want to achieve that? How do I want to move forward? And one of the things we think about a lot with this is, anytime we're trying to make a behavior change, we want to think about really specifically, what is the goal that we're trying to do, and make that specific. So I will take my meds on my own for a full week starting next Monday. So being specific about what you're going to do and when. And you want to think about, as you're trying to make that change, do I have the capability to make this change? I know my medications and what they're for? I know my medication schedule. I have one that works for me. I've learned how to take my medications. Okay, capability-wise, I'm good. Opportunity. Is this week that's coming up, is that pretty stress-free? Like, is this a week that's a good idea to have a challenge? Are my family or my friends supportive of me doing this? In terms of the opportunity, what are the things in my environment that might help me out? So I've got my alarm on my phone to remind me. I've got my medications laid out by my toothbrush, because I have to take this medication twice a day, and it makes sense to connect it to my toothbrushing. Whatever sort of is going to fit for you to help you to make sure that you've got an environment that'll help you to make the change. And then, are you motivated? So do I actually care about taking my medications all on my own? Maybe yes, maybe I do. Maybe I'm just trying to get my parents off my back. Whatever it is this goal important to me? Is it specific and measurable so I can tell if I did it? Do I have a backup plan? So if I mess up, it's okay. I know it's going to happen. People forget their medications. It's going to be okay. How am I going to get back up and try again? And maybe I'm going to reward myself on the days to make sure that if I do take my meds without help, I get a little incentive to do that. So sometimes using that behavior change framework can be kind of helpful, kind of recognizing some of our time too, Lindsey. So I'm going to really run through a couple of these ideas around just some general tips for getting ready for adult care, knowing your health history, finding out who to talk to if your healthcare changes before your adult care appointments. Know what the backup plan. So if things don't go as expected, as you think that they're going to go in adult care, what do I do? And trust your gut. There are young adults who put together these slides for me to sort of give these tips from our Transitional Care Committee, say, trust your gut. If you're not sure, speak up and ask the questions. Before you go to adult care, knowing who your new provider will be and how to contact them, when to expect the first appointment. Is it that I'm going to be referred, but I won't have an appointment for at least a year? Knowing that. A number of young people will say, you know what I didn't realize is it was a little bit more emotionally challenging than I realized to make this transfer. How do I get some of the emotional supports or other supports that I need? And making sure before you leave adult care that you've got enough medication refills and supplies to last you to your next appointment. As you get ready for your next adult appointment, you want to think about a number of different things. First off, that you can invite someone if you need to, and if you want to be part of your appointment, that's okay. Want to check your prescriptions, see if there's any ones that you need to renew. There's nothing worse than like the next day after your specialist appointment, looking and going, oh my gosh, I only have 2 more pills left. What am I going to do? So check those prescriptions before you go. See if there's any forms you need to fill out. Write down your questions before the appointment, and confirm where you're going and track your symptoms. And then at the appointment, make sure to go even if you're feeling well. So this is one of the things that sometimes happens. We're like, oh, I'm good. I'm fine. And so we missed the appointment, because if we missed it in pediatrics, it would have been fine. Like they would have found us a spot at some point to go. In adult care, it doesn't always work the same way. So if you miss an appointment, that can be challenging to get back in. So even if you're feeling well, go. And check in with them about who to talk to and when to contact your specialist, and ask questions if you don't understand. I will say just a couple of things for caregivers as well, that this can be a bit of a challenging time, right? So trying to create space for your young adult to be excited about the move or to be scared about the move. Okay, be ready for all those emotions. And one really great tip that a parent talked about is always connecting with her youth before the appointment. What do you want to go over? What's important to you? How do you want me to be involved in this appointment? Go for the appointment, see how it goes, have a snack afterwards, and have a little debrief. Did that go as you wanted? What did you learn? What do you want to try to do differently next time? Having these sort of like pre-appointments and debriefs afterwards, as a caregiver, can kind of help you also to realize your young person is ready for this, and knowing that you're not alone. Lindsey, I know you've got more information too about managing your journey. Yeah. So I'll let you to it.
Great, thank you. So, the soft skills side, I think, is an area that, we probably, and you're going to not hear a great deal from your actual cardiologists or GPs, but that really is a lot of the work, especially when you're, 18, in your 20s. I think underestimated how much of that I would navigate as a young person. And also being my own advocate. It's actually how I became, being more confident about healthcare, was because I had to not only interact with it so often as I got older, but that, knowing what was happening, knowing why I was there, and that their care was important to my future, was incredibly important. So it can get a little bit, you want to just go off to university or go to school or go to work, hang out with your friends, have fun. You want to dismiss having something that's quite so serious, or, your risk for aortic disease is high. So it can be a bit of a drag. I get all that. And I lived it, of course. But I'm now 52. So again, that tells you that I did all the things I was supposed to do, maybe not always 100% perfectly, but very well. I took my medication and I went to see my cardiologist appointments every year. And I have had elective surgery when it was appropriate. And so it's incredibly important. So I just really want to encourage that part. It can be, I know it's a drag, but it's really important. But on the flip side, finding the balance, I think that is kind of the key to this whole thing. You still need to, navigate the healthcare system. Everybody does, but obviously the weight can be a little bit more when you're dealing with something, a genetic aortic disorder. So find that balance, check your boxes, do what needs to be done, but also it also helps you ensure that you have a really good quality of life, because that security and that feeling that you're well taken care of can really help. And also remembering to make sure you have time for fun. Obviously, stress when you're young, going to school, working, stress, anxiety, and also depression can be very linked to a chronic health condition. I definitely experienced in my late teens and 20s, and I reached out in university for resources. I've also reached out throughout my cardiologist system. We always had a psychotherapist at Toronto General when I was seeing them. So these are things that you know what I mean? There's no shame nor about asking for support when things are complicated and difficult. Um, I also mean about looking for other resources. Obviously, there's things like GADA, there's things of online forums, lots of younger people all talking to each other. It's always helpful. I find that it's important to find people like you. It does make a difference. As well as, to this day, again, at my age, I meet up some of my friends who are my age going to have their checks. We'll meet for a coffee after their appointment. Like we still do things like that because because they can talk to each other. We know the world, we know what we're dealing with, we know, you know what I mean, what they may have been told, what they want to discuss. So those resources are available, and I think it's good to reach out for those, as well as something that I used a little bit when I was young, but and also in my working life, was accommodations and accessibility tools while I was working. It could have been, it could be any reason that you're dealing with, whether it's physically or otherwise, that might be making it a little bit harder for you to, hey, sit for a long time, or fatigue is an issue, or for me, it was visual issues. So don't be afraid to reach out for those resources because they're definitely more aware about chronic illnesses and more chronic illness related fatigue and things like that more and more these days, which I think is really helpful when you're trying to get that degree or go through school or in the early days of your working career. And then the other thing is these other things are going to come up. So career, picking a career is obviously is sometimes you have to think about it a little bit more. Maybe you can't be a guy who, hangs off the sides of buildings, or for example, this is a random example, but you know what I mean? Just being a little bit thoughtful about what your body is doing, and picking a career that's appropriate, which most people do. And then obviously lifestyle, all those boring things like eating well, exercise, all those things help the whole thing work a little bit better. And then when we get to the genetic aortic disorders, obviously family planning is part of that whole story. And it's something, these are not things we're going to get into today, but those are topics that I think that, looking for resources about how to guide some of those are also helpful as you proceed through your care journey related to having a genetic aortic disorder. Again, of course, you are not alone. You are absolutely not. You know what I mean? I'm proof of that. So there are lots of people like me out there. There's lots of younger people out there. There are other caregivers who are talking to each other. So they're also available. And we've also got organizations like GADA who are available and you can ask questions, as well as, the healthcare system. And there are more and more people like Jacklynn out there who are available to speak to as well. So, and I just want, to reiterate that it's normal to sometimes feel a little bit overwhelmed by having something like this, but it's okay, and it will be okay. So transitional care is something that everybody's going to have to go through at this stage. So the system, I think, is becoming more and more patient centric and taking this a little bit more seriously, obviously, than it did when I did it at 35 years ago. So I think you're in good hands.
Thanks, Lindsey. That's so helpful. There we go. I do want to share a couple of different resources as well that are out there just in case those are useful. So the My Transition app that I talked about is there, and you can look at different goals that are there, different things about kids' health through the Canadian Pediatric Society and Sick Kids. They have a teens connection that has a whole section on transition. There's also a health hub in transition through Children's Healthcare Canada. And certainly asking your care team about sort of condition-specific resources they might have. I'm certainly not the same, but for instance, the congenital heart disease folks have a piece called I Heart Change, and it has some opportunities for people to talk with or to see like who's the adult cardiology team and some information about transition with a heart condition. So again, not the same pieces, but may have some useful resources. So there are lots of different things out there to check out. But most importantly, talking to your healthcare team and asking them. Sometimes people do really get worried about asking about transition and transfer, thinking it'll speed it up. And I will say again, good to start talking early and often about it. And thinking about what you can start doing to manage your own healthcare now. So before your next appointment, think about those questions you have for your healthcare team, write them down, make a plan with your family if you need, or make a plan with yourself for how are you going to get those questions asked and answered. And one of the tips that one of our young people says is that she usually writes her questions down, and then especially if she thinks it's going to be a rushed appointment, it's going to be faster than she usually thinks it's going to be, which is sometimes what happens in adult care. She writes out a second set of questions, especially maybe even if she's anxious and she's worried that she might not ask the big hard question. She'll write it down and then give a copy of those questions to her doctor so that they can work on those questions together. So different strategies you can use to make sure that the questions you have are being answered. And certainly if you're worried, like I'm really struggling to take my medications, I need some help with some of these pieces, make sure that you ask. And ask in different places too. One of the highlights we found recently too is that some schools have health services that we know to go to for accommodation support or things like that, but also might have health services teams that are used to working with young adults navigating a healthcare system. So going there and asking for help as well can be helpful as you're trying to figure out what school to go to. You might be asking, what supports do you have at that school to support me with my health condition? And I'm going to give a little bit of a plug. At the IWK, we have a committee of patients and families that help us to sort of work through this process. But I say this to say sometimes there are things that you can do to help the system more broadly that then make you feel like you've got some skills to navigate this yourself. And again, talk about it, start early, know your champions, try it on your own. And think about what was helpful from today and what you want to remember from today's session to help you sort of think through what's next. And I'll just share some of the references that are there for some of the things that we talked about. That's great. Thanks so much. Andrea, I'll throw that to you.
Thank you so much, Jacklynn and Lindsey, for sharing your experience and your journey with us today. I'm just looking at the chat. I don't see any questions, but if any of the participants have any questions, now would be the time to either to put something in the chat and we'd be happy to discuss it. I'll just give it a second. Okay. All right. I don't see any questions coming in.
I think a question, if I might ask something based on some of the communication we've had from some people lately. Because this transition necessarily takes place at 18, what do you do if you're dealing with a child or other family member who's transitioning from pediatric to adult care, who might be maybe in denial about the seriousness of the condition or is resistant to the structure, maybe an accountability that might be required? You know, it may very well be a function of being that age. But what do you do as a caregiver when you're not, it's not an easy transition.
Lindsey, do you want to start and then I can connect? Is that helpful?
Well, it's, it's a hard one. Obviously education is power. I think that's part of it. And as I said, knowing people like you, I think make a big difference too. If I think to the times the people that I knew who were resistant, when they were sort of my age, it's often because about wanting to fit in. It's often to not being able to made to feel like you're different, especially if you're going into a new school or work environment. It can be difficult to identify yourself because you may have a very particular rare something that you have to disclose. I think it's, there's no easy answer other than encouraging, as I said, those base level things. The two things that I always say to people is take your medication and see your cardiologist.
Yeah.
If those are the only two that you're going to commit to keep yourself safe, you know what I mean? Obviously, if you've got other programs, you've got other things going on, I'm not, you know what I mean? Not saying anything else, but from an aortic risk point of view, from taking care of your aorta, those two things are the sort of the bottom line that I would, that I never messed around with, that I never, was not careful about as a teenager. And I think it's also, I'm 52 now. So it kind of, to me, I did what I was supposed to do.
Yeah.
So it's
worked.
not perfect. I've had elective surgery, but it has, you know what I mean? It's worked. So those are kind of the things that I would say.
Yeah, that's great advice. I mean, the bare minimum, right? Your baseline should be take your medication, keep up with your appointments, and maybe this came up, I think, a couple of times as well today. Try to find some sort of community where you're able to, be in communication and among peers who understand what you're going through. Might alleviate some of what's happening there.
100%.
Yeah.
And that goes for parents as well. So having peers who are also learning how to parent through this time, that know that you're not alone in having a young person who is struggling with this. So yes, you're maybe going to try to make sure they have a peer connection and maybe some therapeutic support, because sometimes maybe there's a social worker, a child life specialist, a health psychologist who's on the team. So maybe that's great for them. Maybe also it's for you around, how do I parent through this experience? How do I manage all my concerns and worries? And how do I have a peer group that helps me through that? And also remembering that this period is the brain learning, and we learn by growing and messing. And this is hard when the messing up feels like it could have such dire effects. So trying to figure out how to manage that worry for yourself is really hard. But can be really important. And knowing that sometimes the adolescent brain, right, is developing till we're 25. And that it needs risk to grow and learn. So how do we figure out some healthy risk that might sort of help to sort of manage some of the other unhealthy risks, right? And that again is some of the balance. But sometimes there's things about trying out for a school play is risk, right? To a young person, putting yourself out there in different ways is a risk. So how do we sort of get that healthy risk so that we've got the ability to navigate our healthcare system and navigate our health without taking as many risks? And again, getting some support for yourself, because it is not easy to parent through this experience as well.
Yeah, I think that's great advice. I mean, we forget that the prefrontal cortex is not fully developed until you're at least 25. And so parents, maybe when they're dealing with children that may be resistant or experiencing their own issues in terms of accepting this structure and this responsibility, I think that's really important what you mentioned, that it's important to remember for the caregiver that the child or the young adult, it's a natural, this rebellion or this, exercising their will in this way is natural, and it's helping to find the right way to target that.
Yeah.
That's good advice.
Sometimes similar to the way that our young people will talk about, everybody talks about adult care like the way that people talked about in high school about going to university. Like, no one's going to treat you the same way. No one's going to care the same way. You got to pull yourself up by your bootstraps, because if you don't, it's not going to work. And that messaging sometimes is less helpful to their experience of what things will be like as well.
Yeah.
And just, everyone's situation is different. So sometimes children have been diagnosed with genetic conditions, maybe under the age of 10, before they were really had the ability to participate in a conversation about what does this diagnosis look like over the course of my life. So for people who have inherited conditions, genetic counselors are available to discuss what happens now that I'm a teenager? What does this look like moving through adulthood? I know that we're not always easily accessible due to wait times, but generally, if you can just need to have this conversation with a genetic counselor, the wait time is typically shorter than a new patient would face in medical genetics. And I know that Canada is a big country with lots of rural areas, so we're not all lucky to have a transition team that we have at the IWK and other large centers. But that doesn't mean you can't reach out to primary care physicians to see if you can access a social worker or someone locally to help you with this as well. There is care available even if you're outside a major center in Canada. It can just be a little harder to access, and you have to do a little bit more of piecing various things together versus having them all in one place.
Yeah.
And one of the questions we had was sort of what is the key to a good transition? I feel like you guys have already answered that, but if you wanted to summarize, maybe sort of as a last thing before we let everyone go this evening.
Yeah.
Andrea, can I possibly, there's a question in the box about somebody waiting for some results. And it's a younger person. And it actually did sort of, one of the things that I didn't mention when we were talking about anxiety was I wanted to just quickly touch on that and answer this question live if possible, which is about there is sort of this thing that exists in this community of patients is, anxiety around your appointments. So you're going to your appointment, your yearly appointment's coming up, or you've had your MRI and then you're waiting, you don't see your cardiologist for 2 months. Like this happens all the time. This is very common. And there is a certain amount of anxiety that does exist, and we do talk about it quite openly. And it's not, there's no quick win. It's more, again, exactly the same thing I think I was mentioning before, is reaching out to other people like you to sort of get some peer support, because they know that you can't necessarily take it away. You're going to be a little bit worried that, oh, but what if I go this time and I find out, I have an aneurysm, or things are progressing, or the answer, hopefully they also could just be all great and there's no, problems. So I think we have to realize that that's part of the healthcare journey. And the community and peer support, I think, is a great resource for that one.
And then to answer the second question in a chat, if you don't have a pediatrician because you've aged out of that system and you don't have a family doctor, you can request referrals via a walk-in clinic. Everything's different across the country, but some places, Nova Scotia has something called the Maple app, which is an online service. New Brunswick has NB Health Link. I am sure there are similar things in the rest of the provinces, but there are other ways to access care. I mean, no one loves going to a walk-in clinic and spending the day waiting to see a doctor, but sometimes that's just unfortunately where we're at with our healthcare system, given all the resource challenges we have these days. All right.
Okay, is that it for questions? Is there one more in the Q&A? No.
No.
Okay.
All right.
Great.
So everybody, thank you for your attention this evening. We will have more webinars in future, so watch your email for those. And I wish everyone a good night, and thank you to Jackie and Lindsey once again.
Thank you.
Thanks
Have a
so
good
much.
evening, everyone.
Thank you.